Welcome to Quick Medical Review. Today, cardiac output and hemodynamics in under 5 minutes. Let's go. Buzzwords first. Cardiac output equals heart rate times stroke volume. That is the foundation of hemodynamics. Fick principle, think oxygen consumption. Mean arterial pressure equals cardiac output times total peripheral resistance. Preload stretch. Afterload resistance. Pulse pressure systolic minus diastolic. Let's break it down. Cardiac output, the volume of blood the heart pumps per minute. It is the product of heart rate and stroke volume. Normal cardiac output is about 5 liters per minute. Heart rate, simply the number of beats per minute. Normal range is 60 to 100. Stroke volume, the amount of blood ejected with each heartbeat. It equals N diastolic volume minus N systolic volume. Three things determine stroke volume: contractility, preload, and afterload. Preload, the degree of myocardial stretch at the end of diastole. Think of it as how much the ventricle is filled before it contracts. Increased preload means increased stretch, and by the Frank-Starling mechanism, increased stroke volume up to a point. Afterload, the resistance the ventricles must overcome to eject blood. High afterload, like in severe hypertension or aortic stenosis, means the heart has to work harder and stroke volume drops. What increases stroke volume? Catecholamines, increased intracellular calcium digoxin, anxiety, pregnancy, and exercise. What decreases stroke volume? Beta blockers, heart failure, acidosis, and hypoxia. Now, the Fick principle. The rate of oxygen consumption can be calculated by comparing oxygen content in expired air versus inhaled air. Arterial and venous oxygen content can be measured directly. This gives us cardiac output indirectly. During exercise, cardiac output increases, initially by increasing stroke volume and later by increasing heart rate. Mean arterial pressure equals cardiac output times total peripheral resistance. You can also calculate it as diastolic pressure plus 1/3 of the pulse pressure. Pulse pressure, the difference between systolic and diastolic pressure. A wide pulse pressure suggests aortic regurgitation or hyperthyroidism. A narrow pulse pressure, think aortic stenosis, heart failure, or cardiac tamponade. Here is a clinical connection. If a patient is in septic shock, what happens? Peripheral resistance drops, so mean arterial pressure drops, and the body compensates by increasing heart rate to maintain cardiac output. In cardiogenic shock, the pump fails, stroke volume drops, cardiac output drops, but peripheral resistance goes up to try to maintain mean arterial pressure. Example, the single most tested concept here. Cardiac output equals heart rate times stroke volume. Know what increases and decreases each component. And remember, mean arterial pressure equals cardiac output times total peripheral resistance. If one drops, the body compensates by increasing the others. That is the basis of shock physiology. That was cardiac output and hemodynamics on Quick Medical Review. Study smart, not hard.